Good morning, everyone, and welcome to our latest edition of Three Plastic Surgeons and a Microphone. I'm Dr. Sam DeJurikar, Instagram handle at Sam DeJurikar, and as always, happy to be joined by my compatriots, Dr. Sam Rhee of Paramus, New Jersey, whose Instagram handle is at Bergen Cosmetic, and Dr. Sal Pacella in San Diego, who goes by at San Diego Plastic Surgeon. And just a brief bit of legal stuff before we get into the meat of the program. This show is not a substitute for professional medical advice, diagnosis, or treatment. The show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. And always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of anything you may see on this show. And today we have a different sort of show, a very special show. We're very sort of gratified with what we're going to be able to do. We're going to talk about charitable endeavors in plastic surgery and talk about a project that Dr. Sal Pacella of San Diego has been working with extensively. So with that, I'm going to turn it over to Dr. Pacella and he can give us some intro.
Thanks, gents. Well, once again, everybody, welcome to our podcast this morning. I'm super excited to be talking about an organization that's very close to my heart called Fresh Start Surgical Gifts. I was introduced to Fresh Start by one of my colleagues, Dr. Mike Brasher, who's a local plastic surgeon and very good friend here in San Diego about 12 years ago when I first moved here. And it's an organization that donates plastic surgery services, cosmetic or reconstructive services to underserved children all over the world, including the domestic United States. And, you know, this organization is just a fantastic organization. It has a slightly different model than a lot of other volunteer surgical organizations. And we're going to dive into that in a little bit here. So just to intro here, gents, you are both involved in some charitable endeavors in plastic surgery, correct?
Yes.
So Sam, Jersey Sam, Dr. Rhee from Paramus, tell me a little bit about what you're involved with.
I think all of us at Michigan all started with Dr. Bob Gilman when we were residents. A lot of us traveled to Colombia, South America, and worked with him on cleft palate and lip repair trips. And after that, I've traveled with Sam and other people to Bangladesh, and I've been to China, I've been to North Korea, a couple different places. But I think we all have had a long history of charitable care and giving back in surgery.
Yeah. So I've been fortunate enough, as Dr. Rhee sort of alluded to, several years ago, he actually took me on a trip to Bangladesh, and I hit it off well with that organization, Smile Bangladesh. So every year I go to Bangladesh to do cleft lip and palate surgery. Dr. Rhee was on the board of directors, and when his time is up, they asked me to take his place. So I'm currently on the board of directors for that organization. So it's a huge part of what we do. It's so incredibly gratifying, as you know, Dr. Pacella.
Awesome. All right. Well, without any further delay, I wanted to introduce a colleague and very good friend of mine, Shari Brasher. She is the CEO of Fresh Start Surgical Gifts. I've known her for 12 years, and she's just got a wonderful personality. She runs the organization, and she's going to come on and tell us a bit about the Fresh Start. So, Shari?
Hi, everybody. Thank you for having me.
Welcome.
So, I've been around Fresh Start for over almost 30 years now, but we do provide plastic and reconstructive surgery, very similar to all of you, but we do it in the U.S. at hospitals in San Diego and also in Chicago. So we bring the kids to us, which allows us to be able to do some really difficult procedures, which include follow-up and sometimes hosting the kids and having them live in a home here nearby so that we can have more than sometimes several procedures done at different times within the year.
So, Shari, thanks for coming on. We really appreciate it. So tell us a little bit about how Fresh Start started? What was the beginning of the organization?
Well, the beginning of the organization was Dr. Dennis Nigro. He had a private practice, and he was helping kids who came in that couldn't afford the surgeries that he was talking to them about. And he had a hard time saying no to anybody. So he started doing them on a Saturday in his office, like every 3 months or so. He'd pick a Saturday and have 5 or 6 patients, and our staff was volunteering time. And at that point in time, I was working for him as his business manager. And that turned into a partnership with another freestanding surgical site. And then finally, it's been several years, about 12, that we've been working at Rady Children's Hospital and have a great relationship with them and partner on doing these surgeries at their facilities.
That's great. So how exactly is this? Maybe describe a little bit about how the surgery weekend runs and how we sort of go about prepping patients for surgery. What's the process for applying for surgery that patients may have?
Yep. So we are mostly through the internet or verbal referrals from people. And if you go to our website, freshstart.org, there's an application for patients that we make everybody fill out, because we have a very sophisticated 8-week process where we have several doctors who get together, and Dr. Pacella is certainly one of the leads on that, to discuss the applications, and only the physicians are making the decisions on who gets into the program and what surgeon would be the best to lead on the procedures. And then we figure out a game plan for their surgical care. And then, of course, we work in our offices to schedule them. Sometimes they come from other countries, so we need to do travel, lodging, visas. We take care of all of that. We pay for all of that. There's no cost to anybody for it. And we house them, feed them, give them their pre-surgical consultations and help. And then, of course, all the surgery. And it's more than just surgery. We also do dental care and sometimes laser to lessen scars, speech therapy if they have something done in their mouth. So it's completely comprehensive and very, complicated, really. Sometimes kids have been patients with us for 10, 15 years, depending on how complicated their cases are.
That's great. Yeah. So tell us a little bit about the medical program committee. What is that? So just to start off, this is the larger group of doctors and coordinators that work together to prep patients. So tell us a little bit about that process. What does that involve?
So we have a meeting every 7 weeks, and it's about 16 surgeons and nurses that come together, and we are able to look at and go over the applications of the patients, see their pictures. We often read the highlights of their stories of why they want the surgery and how it's going to change their lives. In the office, we've already done the background checks to make sure that it's something that they can't afford, so that we are therefore able to help them. And then the surgeons are all sitting around the table collaboratively, which is really incredible to me, because I see plastic surgeons as fairly competitive, which makes them, makes you as successful as you are. And it's just amazing to see them in one room talking about these patients, collaborating and deciding, have you tried this procedure? Have you tried this? And then oftentimes we have more than one surgeon in a room. And so what's incredibly exciting to me is, honestly, these kids, Fresh Start kids, are getting better care than even my kids would get, because you go and see one plastic surgeon. And I'm not saying that one plastic surgeon wouldn't do as good of a job, but honestly, when you have collaboration amongst some of the greatest in one room, I just think that, our kids, even though it's free, it's actually better than what the average patient is paying for.
Yeah, just to comment on that, that is a really fun process for me. I was the medical director running that committee for a number of years, and when we're out in the community as a plastic surgeon in private practice, it's not often you get to collaborate with your colleagues, guys like Dr. Jajurikar in Texas or Dr. Ree in New Jersey. It'd be super fun to operate or take care of patients together. And this is one of the only opportunities I have in my career to really do a team approach to surgery and taking care of patients. And it's really fun. We have a lot of comedy at the medical program committee, a lot of joking back and forth. It's really a lot of fun. So now after the patients are prepped in the medical program committee. Tell me what happens on the surgery weekend. What's that all about? How does it run? And what's the structure?
So the structure is such that at Rady Children's, we're able to use up to 10 operating rooms. I think we've only used 8 at this point. We've, can use several rooms there. We have the first right of refusal on a Saturday, and these surgeons are giving up their time for free and donating their time and expertise to these patients. And they are coming in and just like any normal patient would, they check in, they go through pre-op, they have their surgery, and they have the recovery, and oftentimes we have nurses stay with them in a hotel room or at their whoever's home they're staying at, host home, to get the aftercare. They have follow-up treatments and also follow-up appointments. So honestly, it is just like any other patient that you would see in your own practices.
Okay, great. And then how is the actual weekend run for surgery? Like when is the surgery done? When is the follow-up done? Who volunteers?
Well, everybody who's there is a volunteer. Not a single person is paid, and they literally will come in and have surgery. And depending on what the surgeons have decided as far as their care plan, that we follow that very specifically. We need to drive them to the offices or wherever afterwards. They get all that care afterwards, and oftentimes the surgeon will suggest, they need this next procedure, and we provide and put them on the schedule. So it really is rarely ever a one-time procedure and then they go home. A lot of times they come back for, like I had mentioned before, for laser treatments or any other thing, our revisions. So it's up to the surgeons to dictate what it is that they need, but we make sure that whatever it is that they require, we provide that.
That's great. And from what I understand, and from what I'm involved with, the patients stay in town until they're ready to recover, correct?
That's correct. We don't send them back until the surgeons say that they're ready to be on a plane and flying back. And oftentimes, if they're going to need several procedures, then we just keep them at a host family's home. And we've had some patients live here off and on, for a good couple years, depending on how difficult the cases are.
Right, and that's a slightly different model than a lot of the other organizations that donate plastic surgery, right? Sam, you guys. You go into country, you sort of do what you need to do, and then you take off. And just with your experience, gents, how do you manage that if you have a complex case or something like that?
It's a challenge for sure. I mean, I'm listening to your guys' conversation. It's amazing. You guys can offer so much more than we can. When we go into another country, we are limited in what we can do and have someone recover in just within the few days that we're there. And then when we can't undertake big cases that are potentially life-altering changes. Sometimes if it's going to pose the patient at an undue risk. So listening to what you guys are doing here is quite remarkable, and it offers a whole different level of service than what we're able to do when we go abroad.
That's great. And so, Shari, obviously, it takes a lot of support, donor support, and volunteer support to run a charity like this. So tell us a little bit about how financially, you're able to create all this value for patients on a charity.
We're very fortunate because we have, again, I've been involved for 29 years, and it started out as just, the plastic surgeon, Dr. Nigro, and his staff that donated their time. Then Fresh Start started having their own staff. And of course, I was a volunteer at the very beginning. So for 14 years, I was a volunteer. And now for 15 years, I've been an employee. And now we have 11 employees in San Diego and 2 in Chicago when we partner with the American Society of Plastic Surgeons, and they provide references to us, and they helped us with our site, where it's actually a partnership with the ASPS over there in Chicago with Comer Children's, and we do the same thing there. And we obviously couldn't do any of this without the generous donors that we have. And not only is it some amazing companies like Edco and big companies like that provide the support for us, but Audrey Geisel and Jim Goddess and all these law firms, et cetera, a lot of people. I mean, it takes a huge community. For example, on surgery weekend, it's over 100 volunteers on a weekend that come in to provide surgery to anywhere from, usually 6 to 18 kids. So it's like when you go on a cruise line and they say, oh, you get 2 people for every, one of you as a guest. Well, this is significantly more, and they're getting, like, again, the best care possible, but it wouldn't be possible with the financial help. And, we have several celebrities involved, and it's all donor based. We don't get any government funds. We write grants. We put on 2 events a year, golf tournament and gala, and the rest is people who are generous enough over these 29 years to support us through the thick and thin. Even with COVID, we have people writing checks, thankfully, because we're still providing these surgeries because, they're necessary to the kids.
Right. So with that, you were talking about some of the celebrity donors out there, and I wanted to bring on a very special guest. And Shari, I'll sort of give a little bit of his resume here. He was a Heisman Trophy winner in 1981, national champion for college football in 1978. He was a 6-time Pro Bowler, Super Bowl champion ×2, and Hall of Famer. Correct?
That's correct.
And so that's just a smidgen of his resume. So, ladies and gentlemen, I just want to introduce Mr. Marcus Allen, who's kindly joined us today for a broadcast. Marcus, are you there? All right, we've got him online. Mr. Marcus Allen. Marcus, thanks for joining us.
Good morning, guys.
How are you?
I'm great, guys. I'm doing great, man. I'm
right.
honored to be online with you guys. And hello, Shari. You look beautiful as always.
Oh, thank you.
And one of the most wonderful people in the entire world, guys. So it's an honor to be on with guys, I think, who believe as I do, you're rich by what you give and you're poor by what you keep. So I appreciate you guys a great deal. And all the people at Fresh Start, frankly, and all the doctors that donate their time and their services. So it's great.
Now, Marcus, tell us a little bit about how you got involved with Fresh Start and kind of what your what you do with them currently.
Well, I got to tell you, I was just thinking about that. And I go, like, I guess I was just caught up in the charisma of Shari and her story and what she was doing. And I just said, before even, was able to go to the offices and visit some of the kids that were, I guess, about to or have surgery. I just said yes. I mean, first of all, I think, there's a lot of great stories out there, but most often it's the people that are involved with it. And she's such a great and wonderful and dynamic person that I basically just said, yes, whatever you want me to do. And so I went down and I had the opportunity in San Diego to visit some of the kids. And I was just really, touched by, what these doctors do. And the kids that were there, I remember there was one really rare case. I think you remember this, the young lady. She may have been from Latin America. I'm not quite sure, but she had a rare disease that she couldn't be out in sunlight.
Yes.
And it was just remarkable to see her and to really sort of, look at her life and really sort of say, if anybody could add to or give her some sort of sunshine, if you will, in her life, it would be great. You know what I mean? So there were so many cases like that, guys. And I just, I really, from then on, I've been sort of, in a very small way, been sort of a fundraiser and a spokesperson. I'm always talking about Shari. Every time I have an event, a golf event, guys, which I've donated personally for many, many years. And this recent year, even though we didn't have a golf tournament, I was able to, we didn't have one, but I was able to give, I think, some significant funds to Shari. And I've partnered with her. Now I used to be just a, donate, but now I'm part of the team, if you will, of raising money for Fresh Start, because I think it's such a wonderful organization. Again, they always look at athletes as heroes, and I go like, man, you guys are the heroes. You guys are actually transforming lives aesthetically. These kids come in and they look a certain way, but you guys not only change that, but you change them internally too. I mean, they feel better about themselves. They actually get a fresh start on life. So in a small way, I'm just doing my part. It makes me feel good. It makes me feel good that I'm helping people. And it makes me feel good that I'm working with a wonderful person like Shari and what she's trying to accomplish. And when you have kids that can't afford, services like this, and when you have people that donate their time, and Shari, basically covered it. I mean, it's not just they do surgery and they send you home. No, it's follow up, and it's comprehensive. It is the full package, and to be a part of that, and to again sort of give kids a fresh start on life that can't afford it, it makes you feel pretty good.
Now, one aspect of the organization that's pretty fantastic is not only does Fresh Start take care of international patients that have no insurance, but we take care of domestic patients, domestic kids from the U.S. that may be underinsured. So, for example, patients who may have ear deformities that just are on the border of cosmetic surgery. But you can imagine as a young boy or a young girl going through grade school and being ridiculed for your ears or your nose or your teeth, and how that can psychologically affect someone. It's just really special. And when these kids come in and we have, we're in the Sunday clinic and we have a Hall of Fame athletes coming and helping us change our dressing, that's pretty fantastic.
It's better than fantastic. But I got to tell you guys, obviously you guys think us football players or athletes supposed to be big, strong, but every time I see a video that Shari plays where it transformed a kid's life, I got to turn away because I always start crying, man. They're so impactful, so emotional and stuff. And I go this is what life's all about. This is the best of America right here, guys.
Yeah.
Great.
Yeah,
sure.
That's a good segue, Marcus. So what I'd like to do is I'm going to share my screen here for a second. I just want to show some photographs of some patients and cases that I've been involved with over the years here. So here we go. There we go. All right, Sam, you got that going? Sam Marie, can you see that?
Yep, we can see it.
Yes,
Great.
you're good.
All right, so a few of these are from Instagram. I just kind of downloaded them here. So on the left, we have a wonderful young lady. Her name is Florange, and she was adopted from a couple in Montreal, I believe. Is that true, Shari?
That's correct.
Yeah.
Yep.
And where is she from? She's from Indonesia?
Yes.
Yeah. Okay. And she had a congenital eyelid deformity. And this wonderful, wonderful couple sought us out to assist with getting her fit for some eyelid reconstruction and an eyelid prosthesis. I worked on Florange with one of my colleagues, Dr. Asa Morton, who's an ophthalmologist. And we did some work around her mouth to restore her smile. She had some facial paralysis. And, just a wonderful, wonderful child. On the right here is a young gent. I believe he's from Texas. His name is Junior, and cute little guy. He had a little congenital hemangioma, an eyelid deformity where it was obstructing his vision. And we did a pretty quick little surgery on him to remove some of this hemangioma to get his eyes looking a little bit better. So just a great. Marcus, sounds like you got your hands full there, huh?
Exactly.
All right. Now, probably one of our most fantastic young gentlemen, just an absolute success story, is this gentleman on the left. His name is Beloved Jaffetti, and Beloved is a young boy who formerly was a young boy who was from Africa and unfortunately picked up a landmine, and it caused severe destruction to his face. And at the time, he didn't have any access to medical resources. He was seen at another institution. They did a large procedure for a debridement and a free flap and to reconstruct his jaw. And then he came to us, I think, close to about 8 or 9 years ago. And we've done work on him almost every year to sort of restore a bit of his smile in his face. And he is just a wonderful guy. He was adopted by a family, the Tinnies in San Diego here. And Beloved is just an absolute American success story. He came here with minimal education, went to school, got his high school diploma, and now currently is in college, and is applying for U.S. citizenship. He's just a beautiful young gentleman, and we're so
recently got engaged.
Recently got engaged. That's right.
Oh, wow.
Right. So just a wonderful guy. Here is on the right side is our latest procedure we did just this past 2 Saturdays ago. So this is my colleague, Dr. Jeff Umansky, who I operate with. And we did a bilateral gynecomastia case on this young gentleman who's from the United States. Here's another guy on the left, Ricardo. Ricardo is also from Texas, underinsured. He had a congenital ear deformity here. So this is him on the lower left, right the day of surgery. We performed his surgery. He came out looking fantastic. This is him a few weeks later, sitting next to me on the right. And, he's just ecstatic. And his little brother, I think, is going to come and see us at some point as well. He's got some ears there, too. So on the left here, these are a few of our volunteers. This is Dr. Victor Chung and one of our one of our older surgeons who's been operating with us for a number of years. So, this is Georgiana, one of our patients who was born with congenital eyelid deformity and some loss of bone on her nose. And you can see her on the right side. She was just having some difficulty closing her eyes. And I did a procedure on her where we took a wrist tendon and reconstructed her eye to maintain the position of her eyelid. So another fantastic success story here. So I'm going to stop sharing. We'll go back here. So, as a surgeon, it's just been really fantastic to be involved with the organization. The beauty of the way Fresh Start is structured is I can continually donate my services every 6 weeks, and throughout that time, without really sort of leaving out of the country or disrupting, my life or my family's life for a period of time. And with COVID, this is even much more important that we're able to touch so many lives without really relocating or going to another country. So, and I think one of the most fantastic things is, as I'm sure the two other surgeons on the call will agree, we as plastic surgeons, as doctors, our life is sometimes confused with patients and insurance companies, and it's very easy to lose that doctor-patient connection many times throughout the workday. And the beauty of Fresh Start is this is just a pure connection of patient and physician, and sort of helping others without any of the drama of anything else surrounding the patient's care. And that's just what's really special here. So,
yeah.
I did want to add that, in the almost 30 years, we've provided almost 8,000 kids with Fresh Starts. It represents about $42 million of surgery that's measured by CPT codes. So it's really incredible. And I did also want to mention that every dollar that's donated, 100% of the funds go to the kids. So I was fortunate enough to meet this woman with our founder who donated a very large sum of money to us, which sets in a separate account. We only draw 4% of it per year to pay for all of our overhead, so that I go out and fundraise $1 to $2 million every single year, which covers everything else that we need. And all that money, whenever you donate, literally goes directly to the kids. Not one single penny pays for any overhead.
Wow.
That's fantastic.
That is
That's
impressive.
fantastic. Yeah.
I told you guys she was.
Yeah. Yeah.
Yeah. And, we it's not all hard work. We do have a lot of fun too. Every year Fresh Start throws this butterfly gala, which is a big donor gala, and we have a big auction. We auction off some fantastic weekends and products, and even gorgeous paintings from surgeons and others. And it's really a fantastic evening. Marcus, you've been to the gala before, right?
Yes.
Yes.
It's a fun time. It's a great time. So,
well, everything that they do is, and I think you certainly believe in having a good time while raising money. So it's exciting again, guys. I mean, my hat's off to all you guys and Shari too for creating such an environment that we can go out and raise money, and you doctors provide such care for these young people in their situation. So again, it's good to be a part of such a great thing.
And if you want to meet Marcus in person, he puts on a golf tournament every year in June, first weekend in June, and it's hosted at Pelican Hill. Yep. And he gets all of his A-list celebrities, and they come out, and there's a person who plays in every single group. I mean, the names are huge, and everybody just has a great time raising well into the six figures for these kids. And I just can't thank Marcus enough for what he does. He's our newest advisory board member, and we are so blessed to have him. And
I was really, but I was really happy because we had to cancel our event. Like so many events out there have been canceled, but we were still able to get money out to share this year. So we were thrilled by that, guys, because it's important to us. Again, we like having a good time, but we like raising money too to help others.
Yep, that's great. That's fantastic. Well, so Marcus, we would be we're sort of awestruck football fans here, so we're just gonna shift gears a little bit. We would be remiss if we didn't pick your brain a little bit while we still had you on about your NFL career, if you don't mind.
Go right ahead.
So I'm gonna hand it over to Dr. Ree from New Jersey here. So.
It's funny when I told my wife that Marcus Allen was going to be on our podcast. She's not a football fan, so she didn't really understand. She knew sort of, and then I said, "Listen, this is the only guy." To put it in her terms, I said he won the Heisman, a national NCAA national championship, a Super Bowl, NFL MVP, and Super Bowl MVP, and no one else has ever done that. And she's like, "Oh, okay, so that's wow." Like, so she at her level suddenly realized how elite you were, and to me, like Sal says, it would be wrong for us not to take advantage of being able to talk to someone who's performed at such an elite level for such a long time.
I appreciate that. I'm just glad you didn't say. I fell off my big wheel watching you play.
For your, you look like you could still play right now. It's amazing.
Exactly.
Looks to deceive you, my friend.
So one of my questions is, I do coach athletes at a local gym, CrossFit Bison in New Jersey, and I asked some people what they wanted to know, and one of the questions was, how does an elite athlete like you, after so many years of competing at such a high level, just turn it off? Because suddenly, like as surgeons, we can kind of peter out, we can slow down, we can change our workload, but suddenly you're going from competing at the highest level to stopping what you've done for decades in your case. So what is that transition like?
Well, the transition was easy for me because the day that I entered football, I always said this, and I have to attribute this to Ronnie Lott as well. We said this: it is what we do, it's not who we are. So even though I loved it and I was passionate about it, I never saw myself as just that. I saw myself in many other ways. I saw myself as a philanthropist. Right now, one of my biggest duties is, that competitive edge that you talk about. I turn it on being a dad. That's really, really important, right? Because I think if we look at some of our issues today, some of the things that are happening in society, those are all symptoms to, I think, one problem. I think there's almost 20 million households that have a single parent, fatherless homes. So to me, that's very important. I have a wonderful dad. He's been a tremendous example, and I know the importance of having a cheerleader at home as opposed to somebody who's booing you at home. So, so you never really, turn it off. At the same time, it's like if you approach your career as that's what I do and it's not who I am, I think it's easier to transition because I saw myself as so much more, even though I was passionate about it. I wanted to be the very, very best at that. I never saw myself fully as just a football player.
That's great advice for any professional.
Yeah.
I can see that translate into our lives here. We know many surgeons who, died with a scalpel in their hand and never really sort of, got to know their kids or their family or had any sort of outside interest. So that's great advice, Marcus.
Yeah, he's a Hall of Fame dad, let me tell you.
Oh, I love my little boy, the one that was crying in here.
My nephew Drake, I love him.
Not now, please.
When you look back and you compare your time as a pro football player to now, what are your thoughts about injuries now compared to the past? And what do you see as trends in athletes then and athletes now?
Well, I as I look at the game today, obviously modern medicine is so much better today. And what used to have guys out an entire year or maybe a year and a half, arthroscopic surgery, they're back in a matter of a couple of weeks. I mean, the fact that guys are walking out of the house, rather the hospital, as opposed to, being put in a cast and immobilized for almost, over a year when the leg atrophies to a point you could barely, even recognize it. It has changed a lot. As far as myself is concerned, I was always a little different. I looked at, I understood my body, and I understood that football is a very emotional game, very physical game, and it could wear on you. So I always thought it was very, very important to get away and really sort of do, after the season was over. I really didn't do much physically. I allowed myself at least 3 months to do nothing. I just didn't gain any weight.
Okay.
Because I felt that was, that is a lot more strenuous, a lot more difficult to do, to get back into shape when you put pounds on. And so I relaxed, as opposed to today. I mean, after the Super Bowl, I mean, it's almost like a week later, they're back working out. So does the body ever rest? They have OTAs and they're constantly working out year round. And again, I think it's too strenuous a sport, too physically demanding, emotionally demanding to be almost a year round sport. So I think it's important for guys to sort of know their own bodies, because what happens is you get, some of these trainers that, put everybody in a one size fits all sort of, program, and everybody's different and stuff. For me, I wasn't a big weightlifter, right? I did martial arts and I did a lot of stretching, a lot of running. I did a lot of, things regarding functional strength, and there's some guys that may work for me, but it might not work for them. So it's important to really sort of identify the individual and what works for that person. And for me, I understood my body much better than the trainer did, and I think he, again, playing 16 years is almost like, that's an aberration. I think Frank Gore is is playing currently, right? And he may surpass me, but 16 years, I think, was the most by any running back in the history of the game. And that doesn't happen very often. It's certainly a lot of luck, guys. I was blessed because I had three knee injuries, but none that required surgery. So, a little bit of rest, and then I was back at it and stuff. So, the other thing was, I always felt like one thing you have to do is understand the mental aspect of the game. You never, ever, 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 ever think about injury, ever. You have to say to yourself, you're impervious to all that. And because I think those who think about it, usually it happens to them.
Yeah. I love that mindset.
That's great.
Yeah.
Well, we're about running out of time here, but
guys, I'm just getting started.
You haven't even heard him sing.
Oh no! Listen here.
Well, I'll tell you what. We'll promise you, we'll have you back on. That's for sure.
Okay, next time I'll sing "Oh Beautiful" again. All right? Because I'm patriotic right now. Oh beautiful, oh sky.
Let's just end with that.
Rain. All right, listen, I don't want to.
He's a Hall of Fame singer, though.
Yeah, we got to
sure.
take this. We got to take this group on tour so we can raise some money, guys. Come on.
That's right. That's right.
Hey
Well,
guys,
Marcus,
I appreciate you guys very much.
Thank you so much for
fantastic job.
Thank you so much for taking your time on a Sunday. And Shari, always a pleasure. We'll see you soon. Okay.
Thank you so much.
Love you, Shari.
Everybody.
All right.
Love you, Marcus.
Thanks, everyone.
See you guys.
Thank you.
Bye.